My name is Luc Djousse. I'm Associate Professor of Medicine at Harvard Medical School, Director of Research at the Brigham Women's Hospital, and Director of Science at the Boston VA. I just finished presenting work on the adherence of Life Simple 7 and the incidence of coronary heart disease among participants of the Million Veteran Program. This is a mega database biobank with a target of recruiting 1 million veterans. The endeavor started in 2009 with the active recruitment 2011. With the goal is to reach 1 million by 2020, and as this year, we crossed the benchmark of 620,000. So our work is based on about 100,000 data from participants who provided information on Life Simple 7, which include exercise, diet, smoking, weight, blood glucose, blood pressure, and cholesterol. So the hypothesis was to test whether adherence to healthy lifestyle factor can cut the risk of developing heart attack. And during an average follow-up of 4 years, we registered nearly 5,000 new cases of heart attack among nearly 100,000 participants of the Million Veteran Program. Before I get into the results, it's some of the basic data. The average age was 65 years of age, and over 90% were men, and about 85% were white, 11% black. So only 1 in 3 veteran was ideal on 1 out of 7 lifestyle factor, so which is pretty dismal. So hopefully we should be able to do better in the next years. When you tally the number of ideal lifestyle factor, none of the participants achieve all 7, and only a small fraction achieve about 4 or more. So the majority were 1 ideal on 1 or less. About 50%, 1 or less ideal. So our data show that the more number of ideal Life Simple 7 veterans adhere to, the lower the risk of developing heart attack. With the highest risk, the lowest risk was achieved with adhering to 4 or more, where the risk of heart attack was lower by more than 70%. So adhering to 2 plus was associated with nearly 40% lower risk of heart attack. What does that mean? It means a simple modifiable lifestyle factor like regular exercise, eating a healthy diet which is rich in fruits, vegetable, whole grain cereal, low-fat yogurt, less of red meat but fatty fish, bake, broil, not fry food, because if you deep fry your fish, that's not good. So we have to make sure that we're not eating deep fried fish. Even though we hear that fish is good, it has to be boiled, baked, or broiled. So, and not smoking, more importantly, and keeping a healthy weight. These are the ideal factors that would help veterans cut down the risk of developing heart attack. So some of our colleagues talk about medicine like aspirin, taking aspirin, and one of our renowned colleague, Professor Henneken, he said it well that patients, before they take the aspirin, maybe they should go around the block for a nice stroll. And I would add to that a brisk walk. Not if your health can allow, not walk slowly, but brisk, so that the heart rate can jump a little bit. That's where you reap the most benefit. So our data, in summary, show that adherence to healthy lifestyle factor, in particular not smoking, exercising at least once a week, sticking to a healthy, heart-healthy diet, keeping a healthy body weight, can lower your risk of developing heart attack among veterans. So hopefully we're going to increase the number of people adhering to those healthy factor over the next year based on dissemination of these promising results. Thank you very much.
Okay, now while I have you here, I want to ask you something, because your research sounds like, depending on where people are doing their research, you can get different results, right? America versus, what benefit do you find for being here and talking, rubbing elbows with investigators from all around the world? Is it adding a new perspective or a new to what your thinking is, like to Europe for the same type of research? Oh, shoot. 1 second here. Yeah, just give me what benefits are you taking home to your research from being here at the Congress?
Well, I would say this is a very, very rich experience sharing expertise among renowned researchers, scientists, clinicians. We learn a lot because in research, humility is key. So if you keep an open mind, you're always going to learn new things. So a different talk gave us good idea that we're going to go and try to implement in our data set and try to answer important questions that so far have not been answered, or only small, medium-sized cohort were able to address. And with the veteran, where we have right now 600,000 and looking forward to reaching 1 million, it's a rich database where we can slice it, men separately from women, different ethnic group, old, young, middle age, et cetera, et cetera. So it's always a valuable experience to come to this meeting, because you learn the cutting edge science, and not only your growth in your research, your training, but you become you learn how to become a better scientist, better public health person, better advocate for your patient.